Welcome back to the Pediatric Speech Sisters Show. I am so excited for our guest today. We have Daniela Munoz, and I reached out to Daniela actually a little bit before July. It was going to be, or it was Minority Mental Health Awareness Month. And one thing that I think is lacking is research when it comes to, and awareness when it comes to the mental health of Black and Brown communities, specifically the Latine population and also African American populations. So,
Mhm.
although anyone who is listening to this and have been listening to the show for a while and following me, I do have a passion for the Latine population, but I'm still not the one to, I'm not an expert when it comes to talking about their mental health. So I reached out to you, and I'm just so grateful and thankful that you are willing to come on the show and speak to predominantly speech language pathologists on this topic.
Of course. I'm so excited. I'm grateful to be here. Thank you, Melanie.
Absolutely. So I'm going to go ahead and do your introduction, and then just let me know if there's anything else that you would like to add.
Sure.
Okay. So Daniela is a bilingual school psychologist from Mexico. She moved to a town near Cleveland, Ohio 15 years ago and currently works for a large district where she's able to help multilingual and immigrant students. Daniela currently runs an Instagram account, Spanish Psychology, where she translates education and psychology terms to Spanish and shares important cultural information to help educators better serve their Latin families. Some of her passions include social justice, inclusion, accessibility, advocacy, and political activism. And Daniela, you definitely do all of those things. So thank you so much for your service and the impact that you've done for us in the Instagram community and outside of there. Is there anything else that I may have missed that you would like to add?
No, I think you got it all. Thank you for that.
Sweet, sweet. So actually, could you tell us what is your why you do what you do with Spanish psychology and overall joining the field of psychology?
Yeah, so ever since I was little, I wanted to just work with kids. I'm the oldest in my family, and I've just always been around kids and being, asked to take care of kids, and I just love that part. I actually thought for a while that I wanted to be a pediatrician, so I thought I wanted to go into the medical route. That's kind of what I focused on. And as soon as I made it to undergrad, I went to Miami University, Miami of Ohio, not the cool one. Um, I just noticed it was not for me. I was not enjoying the pre med track. Chemistry was just not my friend. It was not it for me. And I went in also being a psych co-major. So I really enjoyed my psych classes. I had taken AP Psych in high school. So I had a little bit of background in it, and I found out that, that's what I really enjoy doing. So I decided to just dive right in and make it my sole major. As I went on, I decided to also tag along a sociology minor. And with that, I feel like it just complements each other, where psychology is really about the mind and the individual, and sociology is more about how the individual acts and survives and just lives within the society made up of other people with their own individual mind. So I thought that it was perfect. In sociology, we really delve deep into how school is a huge agent of socialization for students. It's, we spend most of our young lives in school, specifically during the day where there are a lot, and we learn so much both consciously and subconsciously. So I was really into that, and I still didn't know what I wanted to do. I feel like a lot of people go into psychology and just think I'm going to be a therapist, like a clinical psychologist, because that's kind of what you think is the only thing you can do with psychology, when actually you could do much more. And so while I was, in a lab as a research assistant, we had different grad students come in from different backgrounds and talk about what they're doing with their psychology degree. And one day we did have the school psychology group come in, talk to us about what they do. And I just thought like everything clicked. Everything did. And I was like, that is perfect. I always liked school. I've always enjoyed it. At some level, I always wanted to be involved with the school. And I just thought that's literally the perfect way to incorporate both of my studies and fields of study and passions was to be a school psychologist. So that's how I ended up in the actual career. As for Spanish psychology, so I recently graduated from my program, I want to say 3 years ago. So I'm fairly new, early career, still have a lot to learn. But I remember I want to say my internship year, I went to Mexico, and, the family's like, what are you doing? What are you going to do for work? All of these things. And I found myself not being able to explain what a school psychologist was. We don't really have that in Mexico. We don't really have a structured and ethical special education law or field. So it was very, very hard for me to kind of explain those things, as well as, the terms. I was like, how do I say this? How do I pronounce this? Because I didn't learn psychology in Mexico. Clearly, I was here. And they're not really terms that you just grow up using. So I did not know many of the terms in Spanish. And I even thought of, about like, well, when I work with parents, I want to be able to educate them and empower them in their own language, being Spanish. But in order to do that, I have to know it first. So I was always thinking about that. And I was on TikTok, and I came across this doctor who would, she would do dances on TikTok, but then she would explain, cardiology and then what the translation was. And I thought that is amazing.
Yeah.
It's a great way, one, for the content creator to learn the terms, to share them out, and reach patients, people in the field or not in the field, but will be. I just thought it was awesome. So that's when I went back to Instagram, which is the platform that I'm most familiar with, and looked to see if anyone was doing something like this, because I was like, I want to learn, but no one was. So I said, well, let's learn together. So I created the account and just started going from there. In the beginning, if you go back to my posts and even in my highlights, it's very term heavy. It was very much like, this is a term that we use, this is how you write it, and then how you pronounce it. And I recorded myself saying the term. And I still do that. I have a running document with terms that I share with my followers so that we can all kind of pitch in and learn from them. But now and then it grew it grew with interest. I started talking more about I have some posts called culture shocks, which is where I explain, this is what many Latin American countries do or think, or the way their school works, which would be a culture shock coming to America, and how we can help them. So it became more global into not just terms, but how to help Latin American families and Latina families. And then, of course, with the stress and everything, I also made a little humor outlet, and I also create some just funny little reels and posts and memes for people to laugh, and overall just create a community and a safe space through Instagram. So that's kind of how that was created.
Yeah, you are very generous with the content that you are providing. I mean, you know that people want to be educated, you know that people want to be entertained, and you know that people want to feel comfort. And I think that your platform provides all of those three wrapped into one account. Can you give us just some examples of terms that we would use? And I'm thinking about even speech pathologists, so maybe in an interprofessional standpoint that would also be in Spanish.
Sure. So a lot of the ones that I started with were very, like you said, heavily focused on special education. So one of them, which you will find very valuable, speech language pathologist or speech therapist. In Spanish, you would say terapeuta del habla o lenguaje. Or, another one would be, let me think. For example, in Ohio, we call the reports evaluation team reports, ETRs. So we would say reporte del equipo de evaluación, or an evaluation report, which is a little more general term, that because almost every state has their own name for these reports, but you could just call them reportes de evaluación Evaluación inicial would be an initial evaluation. And a lot of these terms, funny enough, because we don't have this process in Mexico, not that they're made up, but there's no clear translation. There's no direct translation. You kind of have to take the single words and translate them and then frame them in a way that makes sense. Because, as I said, the titles for those things don't exist in Mexico because many schools just don't even offer those services. So that was a challenge as well.
Yes, I think about because I studied Spanish, I got to go to Guatemala for 3 months, and so we were actually trying to figure out how to say speech pathologist. So there's terapista
Mm-hmm.
del habla, and then there's what was the other example that you use? I always just say terapista del habla.
Uh-huh. Yeah. You can say terapeuta or terapista, both work. That's the other thing. It's just so fluid. Um, and I usually say habla o lenguaje, which is,
Habla o
speech or
lenguaje.
language.
Yes, yes. Okay. And thank you for that. Thank you for that. So I know everyone listening to this is going to feel very empowered to even use that. So, from your experience, what has been the biggest mistake educators and school based psychologists or personnel overall have made when serving Latin families?
Mm-hmm. I think I would say there's two big ones. So one is, you know, and really my answers are going to be based more on, that the fact that a lot, not all of them, but a lot of our Latina population in the US are immigrants or their parents were immigrants. So a lot of them with that immigrant perspective in mind, I would say one of the biggest mistakes that I see is assuming that our education and school systems are the same. So making those assumptions that, like, a family comes in from El Salvador, for example, and, just assuming that they know that email is the best form of communication, assuming that they know that they can view their child's grades online,
Mm,
assuming that they know that they have to be vaccinated and have all these records that they have to do, or assuming things like that snow days happen, or that they know the holidays and they know that they don't have to come in on MLK Day. Things like that, those assumptions that they make that are very cultural, and also, the institutions in those countries are very different than here. So making that assumption that they know that they have to ride the bus. Well, no, they don't. So really
mhm,
taking the
mhm.
time to consider that their school experiences are diverse and maybe very different than the ones here, and kind of sitting down with them and not in a condescending way, being like, where are you? How can I meet you at where you are and show you kind of how the things work here. A funny tidbit with like the snow day thing. We lived in Michigan when I was younger, and it was the first time that we lived in the US where my sister and I actually had to go to school. And my dad would travel a lot for work, so my mom was kind of in charge of that, and she was still processing her own immigrant experience and learning the language and parenting and all of that. And I remember it was a very cold day, very cold, but typical for Michigan. Right outside of Detroit is where we lived. And my mom was like, it's too cold. You're not going to school. So we were like, okay. We just stayed home for like 2 days. And then the school called and was like, are the girls okay? Okay. Why aren't they coming to school? What's going on? Do we have to intervene? And my mom was like, what do you mean? It's too cold. And they were like, no, no, no. We tell you when it's too cold for them not to come.
Mm,
Like we call the snow days, we call the cold days. And she was like, oh my gosh, you're so right. Or with that, when the winter started, my sister and I went to school. They didn't let us go outside for recess because we just had coats. We didn't have the snow boots, the snow pants. Well, we don't know, right? It doesn't really snow down where we're from. So
mm.
just not making those assumptions that, oh, they're going to know those things, would be a big one. And I think the second one is just so simple, but just um, you know, don't think that you can't form a connection because you don't speak the language.
Yes.
I think that's also a big one. We live in a world that has given us a lot of privileges with access to language resources and really helping with that language barrier that we used to have. We still have it, and we have a long way to go, but we didn't have Google Translate back then. I would carry around a dictionary with me
Wow.
and kind of just flip
Yeah,
for like
wow.
form a sentence for what I needed. Now with my phone, I can, connect with anyone from any language. So like let's use those tools and let's not think that, oh, I don't speak that language, I'm sorry, I can't help you. No,
Yeah.
you can. It's going to take some work, but you absolutely can.
And I think that the work is also how you build a relationship as well.
Mhm.
That was also how you build a rapport because it's working both ways.
Right. Yeah. It's showing the effort that we want to put in to help you, and it's seen. Even if, it's not the best grammatically correct way of saying stuff, you are going farther than just being able to say hola.
Mhm. Right, right, exactly. And so that actually brings me to my next question because I am thinking about you talk about culture shock
Mhm.
and how even those cultural barriers of, well, as a mother, it would only make sense for me to keep my children home on a very cold day outside. It's snowing outside. I don't even feel
Right.
comfortable driving on these roads. But the school is calling, and I also understand, and I hate to put a dark cloud over it, but also sometimes administrators can be very judgmental when it comes to parents keeping their kids home during days
Mhm.
really at all. And so what mental health challenges have you noticed with families and their children when it comes to culture shocks like that or any culture shock?
I would say, a lot of anxiety. I mean, think of specifically for the older siblings, the older children. They're the ones who like, okay, they carry the family when it comes to immigrating because parents are obviously their go-to and their priority is safety, security, having basic needs for my family. Whereas the children go to class, go to activities, and they're more in charge of the social aspect of it. How can we get used to the society here? So a lot of it is like go to school, absorb as much as you can from the social aspect and the language, and then come home and teach us what you learned. How do
Mm,
people act here? How are things done? So I feel like it's a lot of anxiety of knowing that um, you have a big responsibility in really learning how things work here and passing that on to the rest of your family and educating them on that as well. Anxiety also with balancing keeping your culture and your traditions and language alive while also trying to survive in this new space and create relationships and friendships and all those things that we crave as humans. It's a lot of like survival skills is what I call it,
mm,
especially, and this is just if you come from a safe immigration system and you're not, you come because, for example, like us, we came here for job opportunities for my dad. Well, there's
mhm,
people here that are coming from war-torn countries. They're coming from being persecuted. So you imagine that also being on top of that, all of that. I think also depression is a big one with leaving all of behind and not knowing when you're going to see them again unless you have the privilege of being able to go whenever you would want. Um, as well as substance abuse is a big one because the Latin culture is we drink, we party, we celebrate, and we do it big. And the drinking culture is very heavy, specifically where I'm from in Mexico. So all of that coupled in and that guilt of if I talk about it and I say that I'm depressed, my parents are going to be like, why? You
mm.
have a house, you have the opportunities that your other family members don't have because you're in the United States. You shouldn't be depressed. So then you don't talk about it and it just grows. So I kind of went into like a lot of them, but I feel like those are the main ones that we see commonly as patterns with our Latine population, specifically immigrants.
And I like how you mentioned immigrants because one client, he wasn't in the school, but he was 4 years old, and he came into the clinic they were trying to label him as having autism. I honestly don't think it was autism. He did have behavioral
Mhm.
challenges, but when I looked at the report, it turned out he just got through the ICE system, and his father ended up getting deported, and they had no idea where their father was. They didn't know if their father was still in Texas or if he was back home in Mexico. And so with situations like that, how could we, and I want to talk specifically really with the children in the family because I'm thinking about his mom. How
Mhm.
can we be more culturally responsive and also empathic when it
Yeah.
comes to those situations?
Yeah. The sad part is a lot of this is political.
Right.
And with things like that, no matter what your stance is, we, as speech pathologists, as um, school psychologists, therapists, we work under ethical guidelines, moral ethical guidelines. And in my mind, it doesn't matter if you're red or blue, right or left, there's a child needing help and asking for help. So taking the politics aside, it's not about immigration, it's about human rights and what's going on. But that is a whole other topic.
Right.
To answer your question, though, I would say one is acknowledge the trauma, validate the emotions, because yes, it's extremely scary to not know where a family member is or if they're okay or if they made it or what's going on. And even more so, a family member that for that child right now was a leader, a pivotal part of the family dynamic. So, acknowledging the feelings, validating the emotions, um, learning more about the system. It's very complicated. It's not like I went through the immigration system, and it's not like I know everything about it either, because everyone has different experiences of how to get here and all of those things. So, kind of learning more about that, providing resources around you. You said you were in Houston, correct?
I was. I'm in Tulsa,
Oh,
Oklahoma now, but I
okay, okay, okay.
did 2 years in Houston.
Okay, so I was going to say wherever you are, you can find resources to provide it to them, whether it's, resources about immigration, resources about just basic needs, grocery stores, Mexican stores, where they can find the things that will make them feel like they're at home. Just that support and knowing like, hey, I'm here for you, and I will help in any way that I can. But I think one of the biggest things is essentially just validating their emotions, because that I cannot imagine how hard that is. And being aware of how that can manifest in their lives, and being prepared for that.
Why would you say that or students struggle asking for help?
So I think there's definitely that language barrier, of course, but if even without that, even if we're talking about Latinas, Latinos, Latines that have been here for generations and speak the language, it's super cultural. I mean, even from the sociological perspective, Latin American countries were collectivists. So it's about you care about the family, you stick with your family. Even if your family hurts you or does something that is not okay to you, it's still family and you still have a responsibility to care or support them. Then you come to the United States and it's an individual society. I worry about myself, I care about myself, and once I'm cared for, I care for you.
Mhm.
Not that it's not a caring society, but I'm saying it's different in the steps. Whereas in Latin American countries, I care about my people and my group, and then I worry about myself. So I think that that's one big part of it, in asking for help. Another thing is we have a very famous saying, la ropa sucia se lava en casa, which means the dirty laundry is washed at home. You don't go around talking about the problems that you have. You don't go around talking about your family and the mistakes that they make. You don't go around complaining about what your family is doing. So that's another thing. It's like, how can I talk bad about my parents? How can I complain as it's perceived when I am here and my cousins are in Mexico, when I have these opportunities that they don't have, why am I complaining? That's another big part of it, of that guilt. Or, for example, one that I felt sometimes was like, why am I complaining when I have my parents with me and my mom doesn't have her mom near? You know, why? So it's a lot of that, you know, don't complain, just work hard, be grateful. That's a big, big part of it. And speaking from my experience, I have gone through therapy. I have anxiety, and it's been a learning curve with my parents, more so with my dad. It's, you know, he is sometimes like, you know, just turn it off, you know, which is like not he loves me and I love him, but it's just the culture that we grew up in. And even from that, the machismo, Latinos are much harder to get through and get to talk about their emotions with, because you're supposed to be the man of the house.
Right.
You know, even when you're 5, you're being called little man. You know, no,
Yeah.
we're kids. And the whole thing about men being able to share their emotions and show who they are, and you know, it's so convoluted. There's so many layers to it, but I do think that those are like the main ones, as well as we have different words. Like, for example, nervios. If you put it on Google Translate, it probably would say nerves. Well, but what is that? You know, worry, anxiety, fear, excitement. So I think there's also the translations and the words that we use, because that can encompass anything here in the US, and that could lead to maybe misdiagnoses or mislabeling. But I think the main one would be the cultural aspect of it, specifically the whole thing of, you know, you deal with your family stuff at home and no one has to know about it because it's personal and it's private. So I think that that's a very big theme in Latinos and Latinas who struggle to seek the help or get the help or accept that they need the help.
And thank you for that. I think a lot about I'm comparing it to African American culture, even though they're similar, but they aren't the same.
Mm-hmm.
I will say in African American culture, it's a lot of keep family things at home, keep it in the family. And I mean, we can get into so many other issues that
Yeah.
is with Black and brown families, but we just do not have time today, honestly. But that that brings a lot of weight on the children,
Yeah.
because what I've noticed, and I'm just thinking about even my nieces,
Mm-hmm.
children these days are so smart. They have access to so much information, and they're just a lot more aware than we are. I mean, I don't know about you, but I feel like I just kind of skated through until maybe college, when I started being like, huh, that was going on in my childhood. You know, I didn't really realize.
Mm-hmm.
But now I can tell my nieces are more inquisitive and they're just more aware of those things. So it's just interesting that you brought that up.
Yeah, and that generation is not scared to question,
Yeah.
which I love. I love it, but also at work sometimes I'm like, all right.
Can you give us an example?
But, yeah, but yeah, like questioning it. A lot of people my age or younger in Mexico I see are questioning, like, well, why can't I talk about my feelings? Why can't
Mhm.
I share with someone, like a mental professional, what I'm feeling? Why are the men in my family treated this way and I'm not? So it's becoming more of a challenge of like challenging the systems and the dynamics that we've grown up with for so long, especially in Latin American countries. And I do apologize, that is my parents'
That's
dog.
okay. That's okay. My puppy's like, his ears are
He's like, who's that?
I'm like, we're about to have a social hour. Well, Daniela, thank you so much for coming on the show. One big question I have to ask is really, how can we be better? So, school personnel, personnel in special education, how can we be better at uplifting the mental health of Latina children?
I think one of the things is truly just to put the effort in. It's a lot of work, and I'm doing it right now. I'm working with students from the Ukraine. I don't speak Ukrainian, but I can empathize.
Mhm.
And if it takes me 30 minutes more to create an email for their parents because I'm double checking things and I'm over explaining things because maybe they don't understand the way, again, our school system works, and I'm translating, then I'm going to do that, because then there's that connection, just putting the effort in. I know it's a lot to ask when we already have a lot of caseloads. We have heavy cases. We have maybe not enough resources. But when it's so easy to download an app like Google Translate and just speak into it, let's do that. If I know that I have a student that can't read or write in English in my class, let's find a worksheet in their language, or a simple lower level English vocabulary based project for them. Like, let's just try. That's just the minimum that I ask, is let's try. Let's not give up, oh, I don't know that culture, I can't help. Or I don't know that language, I can't help. We have access to so much information that we can educate ourselves to the best of our abilities in order to understand how we can better help them. And that is truly, you help one person, it's going to be a domino effect in your workplace, whether it's a school or it's a clinical setting. And just kind of a me thing, collaborating with others. Like I said before we started the live, I love collaborating with my SLPs and my OTs and my PTs. We all bring so much to the table and so much knowledge, and just like being able to work with amazing people and share that knowledge is just awesome. There have been times where they've asked me, like, hey, can you go talk to this student in Spanish, see if you're hearing what I'm hearing in English? Like, just bringing our powers together and working for the student. And I think that's awesome. So awesome. So collaborating and just trying to be there in any way that we can.
Absolutely. And what changes would you like to see done?
I would like to see more people of different backgrounds, whether it's immigrant backgrounds, Black, Brown, Asian, and then I'm talking more school psychology, because as of now, there's not many of us. There really isn't. There's a shortage. So if you have any questions or are curious about the field, please feel free to reach out to me or reach out to resources around you. But also, let's bring more people to the table that have more stories to tell, more information to share out and be able to educate others on. And with that, just be ready to learn. I follow a lot of different people on Instagram. I follow you. I follow other accounts from different backgrounds, Indigenous, Haitian, Black, Brown, African American, all of these people. And I'm learning so much from them as well. But you have to put yourself in that space of being vulnerable and saying, hey, I actually don't know about this. And maybe I've been doing things wrong, and I've got to think about it, see how it's impacting others, and learn. So just being willing to learn.
Oh, thank you so much, Daniela, for all of just that powerful advice that we can definitely learn. And my biggest prayer is that this conversation will really shape and just bring a big shift in how mental health is handled in the school system and really beyond. Where can we find you if we have any more questions, or just really with anything and want to check out your account?
Yeah, so I'm on Instagram as Spanish Psychology. I am very active on there. I'm always posting stuff. Sometimes I'm just like, I'm watching a cool show and I want to tell you guys about it. Like, it's not always, that heavy stuff. I keep it light. I keep it real. You'll see me with my no strips on. I'm going to be real about it. So Spanish Psychology, that is my Instagram. I'm also on TikTok as Spanish Psychology, but that's mostly reels that I make. And then my email is SpanishPsychology1@gmail for inquiries or more in-depth questions. And I'm always happy to chat. Always, always.
Well, thank you so much, Daniela. I definitely will be continuing this conversation with you on and offline. Everybody, thank you so much for coming. Everyone watching the replay, stay tuned. Just stay a little bit longer. We're going to be talking to Leila Fafana about the urgent need for diverse research in Black and Brown communities. Until then, bye, fam.